A very good afternoon to you, and thanks for joining this afternoon's webinar, which is the latest in our NEXUS series. And this afternoon, we're looking at patient engagement, marketing healthcare through patient advocacy. My name's Jaya Calder from High, and before I pass on to my colleague Andrea to introduce our speaker this afternoon, I'd just like to take a minute to go over how we run the GoToWebinar. It's likely most of you have used GoTo as a webinar platform before, but if you haven't, as an attendee, you're automatically on mute, but we positively encourage your engagement. It makes for a much better webinar. So you'll see a question box. Please put your questions, comments, any dialogue throughout the whole of the webinar via that box and just hit send and we'll get that. And you'll also see an icon, we call it the raised hand icon. Now, when we come to the Q&A session, you click on that and we can take you off mute. And finally, the last thing I just need to advise is we're really keen on knowledge sharing and collaboration. So we're recording this afternoon's webinar to share with many more people. So let's kick off and pass to Andrea to start our webinar. Andrea.
Thanks, Jaya. Yes, welcome to today's webinar. We're delighted you're here to listen to us and share the recording afterwards with anyone who may be interested but isn't able to join today. I'm Andrea McCall from the Life Sciences team at Highlands and Islands Enterprise in Inverness. And just to give a bit of context, our NEXUS webinar series is an opportunity to find out more about what's going on in life sciences, health and the technology community in and around Inverness and to make connections. And in case you don't know, NEXUS is our co-working suite in Solasta House on Inverness campus, where life sciences and technologies companies co-locate and collaborate. And NEXUS is funded by the Inverness and Highlands City Region deal and European funding. So today I'm delighted to be joined by Neil Hillyard, the director at Hillyard McDonald, one of our NEXUS tenants. And they are a patient engagement company that specializes in orthodontics. So Neil will tell us a little bit more about his work in the dental sector, but also how he applied his approach to a different healthcare sector and how he improved the success rate of an innovative diagnostic procedure. So that's all from me to set us off, but over to Neil now and his slides and his insights into his work and how he uses patient advocacy.
Andrea, thank you very much for the invitation to deliver a webinar today. We'll be chatting for about 20-ish minutes, looking at patient engagement. So I'd like to start by introducing really who I am and my company, and a little bit of a backstory as to why I'm talking to you around patient engagement. Back in 2013, I was made redundant. So having a little bit of spare cash, I went along to Highland Orthodontics and decided to get my teeth straightened. And my interest in the whole science of orthodontics and dentistry kind of kicked off from that. And it's partly down to the person whose photographs on the screen at the moment, which is my business partner, Sarah McDonald. Sarah was one of the orthodontic therapists at Highland Orthodontics, and she had an amazing ability to make you seem like you were the most important patient to walk in the door that particular day. So I really enjoyed the experience, believe it or not. Embraced this for about 3 years. But during that time, I started a blog. And that blog is now one of the most read patient blogs on orthodontics in the UK. I have around about 110,000 people who visit it every year. And so through that, I've got to know patients very well indeed. And from that, I had an invitation to help the British Orthodontic Society to launch their guide to adult orthodontics. And that kind of sparked my interest in working with clinicians around a topic I find fascinating. So I'm based up in Northern Scotland, up in Inverness. Sarah's based down in London. And together we look after the British Orthodontic Society, the World Federation of Orthodontists, the International Orthodontic Congress, 2 dental teaching hospitals, dental lab, and a number of private and mixed practices across the UK. So just to get started, I want to invite you to all come on in, sit down. We're talking about dentistry, but there's nothing to be afraid of. It's just a standard webinar. Come on in, sit down. There's nothing to be afraid of. It's just standard procedure. Now, this was a quote taken earlier on this year, beginning of this year in January, from a consultant orthodontist inviting a patient in for a procedure. First of all, when you say to a patient, there's nothing to be afraid of, that makes you think about all the things I should be fearful of. And when you talk about standard procedure, standard for who? For me, it's the first time I've gone through this. For you, you might have done it hundreds of times before, but for me, it's the first time. So there's nothing standard about this. Now, I thought this was a one-off, so I hadn't heard this for a while. And then working with a different consultant orthodontist on a project during lockdown, when we put together some comms around what patients would expect when they first go back, when surgeries can reopen, the first draft of a patient information leaflet was delivered to me, and it said in there something along the lines of, don't be worried about the PPE, there's nothing to be afraid of, it's just standard procedure. So clearly this kind of wording is out there and used by clinicians, certainly in dentistry. A quick word on the slide here, that horrific image you can see on your left here, that's something called a phantom head, and this was taken at the Wellcome Collection Museum down in London a couple of years back. Dentists still use phantom heads, they're made of plastic now, but no less scary, and they're used to practice and to learn procedures when you don't actually have a patient in front of you. I want to introduce you now to the workhorse of pre-teen orthodontics, and this device here is called a twin block, and it's used to help encourage the lower jaw to grow forward when it's grown slower than the upper jaw. So children have the appearance of the upper teeth sticking out, it's just the fact the lower jaw hasn't been brought forward. And it's called a twin block because there's two parts to it, there's two blocks. On the very left there, you've got an image of the lower appliance, and it clips onto the lower teeth. It's quite big and bulky, so it makes it quite hard to speak. And the clips at the front and the side dig into your cheeks and give you sores. And there's two pyramids, the yellow and blue pyramids there, and they're used to engage with the upper block. So the upper block is a very, very thick piece of acrylic. It completely covers your palate, it completely covers the biting surfaces of your teeth. So when you have it in, it's very hard to speak, you produce a lot of saliva, you can't really taste your food, and it's generally not a great experience when you first have it. And how the appliance works is that when you bite together, the yellow and blue pyramid blocks engage with the red and green blocks on the top. Now, if you bite together, your mouth's going to be quite open. As you slide your lower jaw forward, those blocks slide in front of the red and green blocks, and it brings your lower jaw into the right alignment. So this appliance is quite interesting to wear. It's also quite interesting to eat in it as well, because if you go to bite into a cheese sandwich, you'll pull a sandwich out and nothing would have happened because your front teeth are apart by about a finger width. So the way to eat a sandwich is actually to kind of bite into the blocks and tear it. Then you have no biting surface, so you then need to crush the sandwich into submission and eventually kind of give up, get bored and swallow it, so you get indigestion as well. So this block here makes you produce a lot, this appliance makes you produce a lot of saliva, it makes you speak with difficulty, and it gives you indigestion. Patient engagement is about convincing a pre-teen to wear this full-time for around about 6 months. To look at this a little bit further, if you look at the quote at the bottom, please make sure you bring your appliance to every appointment. This was a conversation I had with an orthodontist a number of years back, and she was talking to me saying, what a real issue, Neil, in that my patients don't bring their twin blocks, they don't bring their headgear, they don't bring their retainers to their appointments. So I thought about it for a few seconds and said, I think I can fix that for you. So I told her what to do, and she went away. We met up again around about 8-9 months later at the dental exhibition in Birmingham. And she said to me, I don't know why, but it worked. And all I did was change one word in what she said to her patients. I asked her to say, please make sure you wear your appliance to every appointment. Did patients wear their appliance? Not always. Did they bring it? Yes, they did. So that small subtle change here changed the behavior of patients. And that got my interest in patient engagement kind of fired up. Because what I realized was it's the quality of the conversation that the orthodontist and the team was having with the patients that made a huge difference. I've sat through an awful lot of consultations where the orthodontist has spoken about having to wear an appliance, and outwardly the patient is nodding their head, inwardly they're shaking their head. And I've also sat with other orthodontists who have had a slightly different approach, similar words, different way of saying it. And what's happened is the patient's outwardly nodding and inwardly probably nodding as well. So I've done a lot of work looking at how patients engage, and being a patient myself, I've brought that into it as well. And that helped me to develop a model for helping practices and clinicians to better engage with their patients. And this is just part of the model. I don't have a lot of time, so I couldn't go over everything. But the first thing I want to think about is the experience. Now, as clinicians, it's very easy to forget what it's like to be a patient. So writing a blog on orthodontics, being an orthodontic patient myself, I could bring a huge amount of experience to the table. A lot of clinicians may have not had treatment before, or it's been a long time since, so they don't understand the patient experience. The why is really twofold. The why is, from a practice point of view, what gets you out of bed each day? Why are you fired up? Why are you excited about delivering this treatment to a patient? And from a patient's point of view, the why is around about, why should I do this? You want me to wear a twin block for 6 months full time? Why? What's it going to do? And the final part is it relatable? So that relatability is really important to a patient. If you talk about, for example, a Tesla, people often say, well, a Tesla is like an electric Mercedes. So people understand Mercedes, they understand electric, and they kind of then get what a Tesla is. So something needs to be relatable for a patient to understand it. So this is the basis of the model we use when we're looking to improve engagements with patients. So do you understand the full patient experience? And we'll talk about that a little bit more later on. Do you have a really clear why? And do the patients understand how it applies to them? And can they relate what you're asking them to do to something else that they do know with already? We use this to great effect when I worked with Corporate Health, who are a company based next door to me up here in NEXUS. And they do a very, very innovative procedure. They get patients to swallow a tiny, tiny camera that takes 400,000 images, high quality images, on its way south to look for what may be causing them problems. And it's a replacement to traditional endoscopy, which is a little bit more uncomfortable, or some led to believe. And they asked me to work with them to really look at the key issue of how can we make our patients more compliant with the preparation to improve the accuracy of their procedure. And the challenge was, around about 3 days before, they needed the patients to start doing things differently, to change their diet, to take some medication, and to comply with a process that meant when the capsule went down, they could then take some very, very clear images, which their software and their staff could use to find out if there's anything wrong. And patients were not following the process. So I was invited to come in and have a look from a patient's perspective. So the first thing I did was, well, I want to be a patient. Show me what happens as a patient. And that included right at the beginning saying, how do you engage me? What paperwork do you send to me? And how would I receive it? So they got the paperwork, they folded it up, popped it into an envelope and gave it to me. And straight away with my eyes closed, I knew there was an issue there because what I had in my hand didn't have any value. If you want someone to do something for you and to take time to read a complex procedure, you need to give some value. So one of the simple things we did was to change the format into an A4 booklet, to bind it and to print it on thicker, nicer paper. That way, when it fell through the letterbox or was handed to them, it had some value. So the patient experience is very important. So understanding from a patient perspective, you needed to go through and look at it from their side. We wanted to get the why across. And so from the team's perspective, they were highly qualified, very good, really kind, really great people. And we wanted to get that story across. What they had before was an NHS leaflet. So it wasn't great insofar as the way it's designed and the story that kind of came across. It's an instruction leaflet. So we brought more of a story in. So you see here on the image, we have Alice, one of the nurses there, in a friendly photograph, fitting a belt, which is a recording device for a patient. We brought color into the booklet. We changed the design a little bit, and we made it simpler. So we brought across the why. So these people are great to engage with. They're friendly, they're warm. We brought that through the images, we brought it through the graphics, we brought it through the colors, we brought it through the story. Then from the patient's point of view, we looked at the why. So for example, one of the instructions was, we need you to start this preparation 3 days before. As a patient, I'm thinking, why? I've been told what to do, so why? So we changed that to, did you know your colon is over 5 feet long and it takes food up to 48 hours to pass through? This is why we need you to start the preparation 3 days before. So we gave a why for the patient, not just for that, but for lots of other things as well. Then we made it relatable. And if you go onto the internet and Google colon capsule endoscopy, you won't find very much. And what you do find will be quite scary. If you go onto YouTube, you won't find anything at all. So patients had nothing to relate this to. So we created a patient story based on some feedback we had from one of the staff there and some patients. And in that story brought over 12 different points around the need to be compliant and the impact it's going to have. And we produced a booklet. It went out just a short while back, and already anecdotally we're hearing some great things. Patients are reading it. They are joining the phone consultations more informed. They're turning up for their preparation, and they can tell just before they give the capsule whether the preparation is going to work or not, or the process will work or not. And they're seeing much clearer results. I'm waiting to see the first set of computer results that compare the data from 4 or 5 months ago to the data nowadays. But anecdotally, we've made a huge difference there, just by understanding the patient experience, by understanding the why and making it relatable. Moving on from there, I want to talk a bit about marketing, because marketing is also linked around the story. And traditional marketing, particularly in dentistry, is quite expensive. And in order to avoid a race to the bottom, you need very deep pockets. So what do I mean by that? Well, one way of marketing your dental services is to be cheaper than your competitors. And that, unfortunately, is not a great race to enter into, because I may offer teeth straightening for £4,000, my competitor offers it for £3,500. So I offer it for £3,000 and I include free whitening. But my competitor offers it for slightly cheaper, but free whitening and an extra set of retainers. So your margins start getting reduced, and it's not a great way to go into it. So the alternative, in fact, often done at the same time, is to spend more time and effort on digital marketing. So Facebook advertising, pay-per-click. But in dentistry, as in most healthcare, it's quite expensive. So what we tend to find here is your margins are being eroded by reducing your prices and your costs are going up. So it's not a great strategy to follow. So we advocate a very, very different strategy. This is where patient engagement and patient advocacy comes in. This here is a really quite pivotal quote from the well-known marketer, Philip Kotler. And he talks about people now trusting strangers on social media more than advertising expert opinions. So you can place very, very expensive adverts, but people won't necessarily believe them. And it's also talking about the fact that patients are very highly dependent on the opinion of other people. And to give you an example, I'm part of a number of different forums and private groups on social media where adult orthodontic patients go for advice. And it's fairly common to hear on a daily basis, I've been to the orthodontist, he thinks I need jaw surgery. Here's my selfie, what do you think? Now, am I qualified, or is anyone else qualified to offer an opinion on jaw surgery? Of course not, but they go onto these forums and they ask for advice. And the same thing else, should I get Invisalign? Do you think I need my molars out, or whatever else? So the whole marketing has shifted over recent years. And some of you may recognize this is called influencer marketing. And there was a time a few years back when companies paid well-known celebrities, macro influencers, huge sums of money to promote their products. Over the years, there's been a gentle shift toward micro influencers. These are people with a smaller following who are sharing their experience of their engagement with a brand or a product or a service. So if you kind of get that concept, that people are now going online and they're getting advice from strangers and trusting that more than experts and more than advertising, then that's a step towards where you need to be when it comes to engaging with your patients and shifting the burden of your marketing. This next slide is probably the most important slide. So if you've got a note, take a note of this one. If you want to screenshot it, this is the slide to record. And this should be top of the agenda for every single one of your monthly marketing meetings. How can you encourage favorable conversations in order to drive greater awareness of your practice or healthcare business, or in fact, greater awareness of any business? Because marketing is all about encouraging favorable conversations. How can you get more people to talk about your service and talk about your product in the right way? So the next section will be looking a little bit about that marketing and the techniques we use to make that work. This is the model that we use with our clients. And in the center is patient engagement. So every single thing you do has to be related to the patient. And we start with strategy. Now, the strategy isn't a complicated public sector document that runs through several hundred pages. It is simply, where are you now? Honestly, where are you now? Where do you want to be in the future? Honestly, where do you want to be in the future? and how might we get there. And what we advocate is that the strategy isn't written by the person in charge of the business, it's written by the whole team. And that way you get people on board. People be really honest. It's okay place to work, it's not great, given a better offer, I'll be out the door tomorrow. Things like that you want to come out in the strategy. So where are you now? Where do you want to be? And where do you want to go in the future? We then look at people and culture, and by far, this is the most difficult and the most time-intensive part to have a look at, because your entire brand, your entire patient story, your entire brand values are often displayed by the people in your culture. Now, in theory, the culture should come from the person who leads the organization or leads the practice or leads the service. But very often it isn't. Let me give an example. We work with a client in the Midlands who struggled in some ways. And one of the things I did very early on when I worked with them is to walk around from a patient's perspective and pointed out some things. And the sign outside their practice had a horrible mark on it. Someone had just thrown something on it. It looked terrible. So I pointed it out. And a month later when I went back, it was still there. And 6 months later, it was still there. And there was no culture for people wanting to take responsibility. The practice manager left, a new one joined, and I mentioned that to her, and within an hour, it had gone. So the culture comes from whoever has that leadership opportunity. And that might not be the clinician, it might not be the business manager, it might be the person who's been there the longest, or the person with the loudest voice, or the most influence. So people and culture is really important that you have a look at. Next step is processes. So everything that touches a patient, every email, every phone call, every text message, everything that happens from the moment they come into contact with you via social media, via digital marketing, or in person. How can we improve upon that? So give an example, almost every patient in every medical practice anywhere has to fill out a new patient medical questionnaire. I've never seen one that says, "Dear Neil, we are delighted you're thinking about undertaking treatment with us. In order to help us to give you the best possible service, we need to know a bit more about you." It all starts off traditionally with, "You are required to provide the following information." So little things like that make a huge, huge difference. And it's kind of born about because often computer programmers write the text, but you need to look at it through the eyes of a patient. What will engage a patient more? Go and sit in the waiting room. Sit in the waiting room for 20 minutes. What do you notice? What do you smell? What do you hear? What do you see? And again, I've got clients just to do that, to sit in their waiting room, and it's surprising what they notice. We worked with a client in London, had a very, very successful practice. And the individual kind of challenged us to find some changes that he can improve upon, because he was in a very, very competitive area. He had 54 competitors within a 5-minute walk. And we came up with 82 changes. And a lot of it was just sitting, watching, listening, and learning. Small little changes. And once we taught the team to do that, they could start making their own changes to the process. And finally, marketing. Marketing is around about all the interactions with patients. It's about your brand values. It's about your brand story. It's about your brand identity. And is it all coherent? Does it link to your strategy? Does it link to the culture and what people do in your practice? Is it linked to the processes? So this nice little model here works very, very effectively. Can be done quite quickly, but it can take a wee while if there's an issue with people not changing as fast as they need to get to. It's quite important, and that's about your brand. What you're trying to achieve with patient advocacy is about improving your brand. And your brand here is defined, I think this quote is attributed to Jeff Bezos from Amazon. Your brand is what people say about you when you're not in the room. Your job when it comes to your marketing is to help them to tell a great story. And you help them tell a great story by engaging with your patients, by thinking about the patient experience, by thinking about your why, thinking about how you can help them to relate the experience of coming to your practice against something else which is good. Thank you very much.
Absolutely brilliant, Neil. I'm sure that everyone that was on really enjoyed it. Now we are going to move to a Q&A section. And this is where our audience members are the most important part of the webinar, because it's your chance to engage and to ask Neil and Andrea anything that you want about what you've heard. Now, we've had a couple of questions that have come in so far, but there's still time. And also, if you'd like to come off mute and engage with Neil, just, voice to voice, then we'd be delighted to do that for you. So Neil, one of the first questions that have come in, and I've had 3, and I would love you to keep on submitting your questions, so please do that now. But Neil, how has COVID changed the way that dental practices need to market themselves?
Oh, hugely good question, good question. The world came to a complete and utter stop in terms of dentistry back in March. And as you probably know, practice had to close, and it closed very, very suddenly. So they didn't have much chance to prepare patients. So very quickly, some practices switched to an online presence. They switched to delivering their advice online. They switched to delivering support online, and others didn't. So what happened was, in that time, a lot of patients got used to the digital world. They started getting more through webinars. They started interacting at work through Zoom meetings, team meetings, whatever else. So the whole world went digital very, very quickly. And not practices kind of caught up with that. Eventually they did, and they started realizing you could actually have a consultation with a patient just as well when they're at home and you're at home as well, because you can interact with someone via digital means. And you can do it in a way that's convenient for the patient. So just by doing that, you're actually making it less scary and more inviting. Because when you go into a dental surgery, it's actually quite scary. Even for someone like myself who spends a long time in them, quite a scary environment. And for patients, it's a scary place to be. So by taking that initial interaction with the practice into a more safe environment, which is your home, maybe the clinician's home, or maybe the clinician's office, you're starting to lower those barriers and starting to engage. So COVID's actually advanced the profession very, very quickly in a way that it needed to do a few years ago. So COVID's actually been quite helpful. We do need to get back to doing some routine dentistry. I'm sure you've all seen the news and all the challenges that's still ongoing with the risk of infection and so on. And there are a lot of things happening in that direction at the moment. So yes, I'd say in that respect, it has changed it. It's changed it for the positive for those practices who wanted to engage digital means sooner rather than later.
Thank you. Now, how transferable is this to other, for example, non-health customer experiences?
Very much so. I mean, everything I've spoken about applies to whether you run a service or a product-based business as well as healthcare. Engaging with your customers. If you take the word patient out and put the word customers, it's exactly the same. You engage with people and you engage in a positive way. You understand the customer experience. So, for example, when I go to the bank in Inverness, there's only 3 people allowed inside because of social distancing. So you have to queue up outside in the rain. So how does that make me feel about the experience of interacting with my bank? Could they just maybe put some umbrellas out on the day it's raining, you just help yourself? Could they do something just to make it a little bit more comfortable, like a sign that says, we're really sorry you're waiting in the rain, we'll bring you in as fast as we can? It's the small little details when you look at it through the eyes of a customer. So whether you're on a restaurant, a hotel, a service-based business, a product-based business, what's the customer experience going to be like and how can you improve it?
Okay, thanks. Now, we've had a couple of questions in that are pretty similar, but there's a slight difference. And you can choose which order that you like to answer them in. The first one is, can you share some of your top tips for great online engagement with customers? And the second question, what is your main top tip for improving patient engagement? So if we can take the first one on top tips for online engagement with customers.
Of course, authenticity wins every single day. Don't try and be overly polished, overly professional. Don't try and put out the image you think you want to give out. Be authentic, be yourself, be very, very true to your brand values and your brand story. Patients will then pick up on that and engage with you in a much more authentic way. So of course you need to be professional, of course you need to be consistent, of course you need to be putting something out there which is correct and legal and right and so on. But be authentic. And authentic can mean you're having a bad day as well as having a good day, and put out a genuine story. Be authentic. It's definitely the advice for the first one. The second one actually links back to the first one as well. And that's around about the 1% factor. If you want a top tip for improving patient engagement, just improve everything you do by 1%. So before you send an email to a patient, stop, improve it by 1%. Before you invite a patient into your practice or into your business, stop, think about how you can improve that by 1%. When you pick up the phone and talk to a patient, talk to a customer, how can you improve it by 1%? Now, you cannot quantify 1%. What it's about is about continuous improvement, about making it better and better and better every single time. And next time you look back in 2 or 3 months' time, you would have transformed your business quite considerably.
Okay, now our next question is, what's the strategy for marketing this to, for example, NHS clinics where there's likely to be no budget to pay for marketing services, but where patient engagement would actually make a huge difference to the patient experience?
It all comes from the team. The team have to really understand the patient process. The team have to understand every single part of that process. To give you an example, a few years back I was at Reaganmore with my wife. She was due to see one of the surgeons there, and he was running terribly late. So he came into the waiting area with a good few dozen people. And he said, "I'm really sorry, I was running late. I was caught in theatre with someone who needed urgent care. I'm running 4 hours late. If you can, go home, have a cup of tea, have some supper. I will be here tonight for as long as you need me to be here tonight, and I will see every single one of you." There were no complaints at all in the waiting room because he engaged and he was honest. So first of all, it starts with the team. It's about having that consistency around the team so there's no weak link in it as well. Marketing doesn't have to cost a lot of money if you just do it simply and do it well. A few well-placed social media posts, if you're allowed to do that, talking about people and the experience and talking about authenticity works wonders. So without a doubt, it's around about giving that proper story around the experience of being a patient. It's also about understanding it as well. I've mentioned this a few times and it's really, really critical. I'm doing a piece of work with one of the teaching hospitals in London, and it's around about getting clinicians to understand the patient experience. So I came up with a little exercise we're going to do with them, which puts them into patient mode for a short period of time so they can understand why patients are not compliant, why patients are not doing as they ask. And it's a simple exercise we're doing with them. And that will teach them an awful lot. So if you're in doubt, be a patient for a short while, see what the patient experience is like, sit on the chairs, lay on the bench, what you see, what you hear, what you smell, what you feel. And that will actually help you in terms of the marketing. Marketing hasn't got to be expensive, it just has to be done well, has to be done with authenticity.
Great, because the next couple of questions are looking at this whole area through the customer's eyes. And how do you encourage your own customers to be advocates?
Good question. You could ask them, you could say, please leave us a really nice testimonial or a nice review. That works to some extent. It's not the approach we advocate. What we want to do is to create a patient experience that makes them want to talk about you, as per the last slide. So you want people to start talking about the experience. So rather than them, "I'm going to the dentist today, wish me luck, everyone," you want them to say, "I'm going to see Dr. Andrea today, she's amazing." So things like that. See Andrea smiling there. So it's that kind of thing. Now, there's a number of dentists around the country, some we work with, and some of them have got an amazing brand story. And patients say wonderful things because they have such a great experience. And the clinician is so authentic and so open, the patients just love them. The experience is great. So without a doubt, that's the way to go when it comes to this. Your patients will start talking about you if you give them something to talk about. If you give them a good story, they will repeat the story. They will buy into your brand and they will sell your story. They will sell your brand better than you can ever do yourself. You know, if someone wants to contact me directly, I can give you a few names to have a look at. But there's some people who do it exceptionally well. And these people are busy. They have waiting lists 6 months in advance. They are not the cheapest. They have premium pricing. And everyone loves them because they're so strong a character. They've got such a strong brand identity, and their values come through in everything they do.
Thanks. Now let's flip that completely over. And what if it backfires and actually people are saying negative things about your business and their experience of your business?
well, first of all, hopefully that won't happen. If you get the rest of it right, you get the experience right, you get the engagement right, you get the processes right, it shouldn't happen. If it does, there's an old saying that many of you would have heard, there's no such thing as bad publicity. It's how you handle it. So there are some conversations you need to take offline very, very quickly. And a lot of people, in my experience, you can do that. Send us a DM and let's pick this up with you. Let's make sure we can deal with this. Or you handle it publicly very, very well. If you have a very, very strong following from your loyal followers, they will often wade in and solve the problem for you as well. Because a person on social media may say, oh, didn't get a great experience, I felt really rushed. And the patients say, really sorry to hear that. Dr. Andrew is normally brilliant. Maybe she was running behind or whatever else. So patients will often help you out. Customers will often help you out if you have a loyal following. So advice here is don't be fearful of it. Take it offline if you need to. People just want to get their problem solved. And if you can't take it offline or it's not appropriate to take it offline, deal with it effectively, deal with it quickly, and deal with it honestly as well. Your authenticity is so important. And it's okay to say, sorry, we didn't do a good job there. What can we do to make it right? That's absolutely fine doing that.
And the final question, Neil, that I have that's come in before I give the audience a chance to come off mute if they would like to, is your specialism is orthodontics. Do you have plans to expand into other healthcare areas?
Yes, we do. I mean, orthodontics is fun, it's amazing, it's exciting. You know, it's something which we really enjoy. We enjoy the clinicians, we like the technology. It's a fast-paced, well, we teach very slow, but the whole profession is quite fast. There's new advances coming every other month, so we enjoy that. But we also understand the fact that the skills we have can be applicable in other areas of healthcare, and in fact, other areas as well. So yes, lockdown gave us an opportunity to reflect on where we might go next. And in the coming months, we're launching some new products, new services that will appeal to a wider group of people as we move away from, well, still keeping orthodontics, which is great, but moving to a wider audience as well.
Thanks, Neil. Now, before I pass to Andrea, if any of our audience would like to come off mute for a couple of minutes, then please use your raised hand icon now. I'll just give you a few seconds to see if that's something you'd like to do. And while we're waiting for that, thank you very much for your engagement. We've had some great questions sent through. No, well, I'm going to pass back to Andrea. Andrea.
Thanks, Jaya, and thanks, Neil. That was a really, really great insight there into your work and into, I guess, marketing in general, and how important it is to understand your customer and take the time to step back from the day-to-day rush and getting your service and product delivered, and actually just, you know, put yourself into the shoes of your customer and really understand how they experience it all. And I guess that's really true across any product or service that's out there. So it's a really important message. And I really liked what you said about encouraging favorable conversations. That's really what it comes down to, isn't it? So a lot to think about for anybody out there, I think, to make that happen for their venture.
Thank you.
So thanks again. That was really, really good. So please, if anyone's interested to talk more with Neil, please get in touch. I just wanted to let you all know that we're looking for your feedback. So either through the GoToWebinar system once the webinar concludes, or through our SurveyMonkey link that you see on the screen just now, and that we will also send out in a follow-up email. We're recording the webinar, as Jaya said, so you'll all be sent a link to the recording. And please share, as I said, with anyone who may be interested in hearing more from Neil. And we've also got our next webinar confirmed. It's going to be on the 29th of October, yes, at 2 p.m. I'm already jumping ahead to November. We're not quite there yet. And we'll be joined by Alan White from Highland Health Ventures and Alistair Williamson from Wild Technology. And they will talk about a technology trial in a care home setting that was featured in the Herald recently. So it's all about tracking technology that can hopefully help in the current times where COVID restricts movement into lots of different types of venues. So please keep an eye out for email invites or social media or the event on the High webpage as well. But thanks again for joining, everybody, and thanks again for Neil taking some time to speak to us today. Thank you.